So, welcome everyone. I'm Krista Lamb, and I will be your host today. And I wanted to start with our land acknowledgement. IHSTS and the Type 2 Diabetes Network, which does its work throughout the province, would like to acknowledge that we are living and working with humility and respect on the traditional territories of the First Nations people of British Columbia. So, to start today, I'll pass the microphone to the director of the Type 2 Diabetes Network, Edward Smith Griffins.
Thanks, Krista. I thank you, everyone else, for joining us today. I'm the director of the Type 2 Diabetes Network, operated by the Institute for Health System Transformation and Sustainability, or IHSTS. As you may or may not know, IHSTS is a small NGO based in British Columbia. Over the past couple of years, the Institute has focused a lot of effort on developing a Type 2 diabetes strategy. We now have a type 2 diabetes network that is up and running. The focus of the network has been on type 2 diabetes education, and more recently, we've started considering how we can influence the stigma surrounding type 2 diabetes across the province. We're also connected nationally, and I believe there is significant potential for this network's work in the coming year. It's with great pleasure that I can introduce Krista Lamb. She'll be moderating the session today, as she said. Krista Lamb is a science communicator who specializes in translating complex topics into interesting and understandable stories for diverse audiences. Her first book, Beyond Banting, was released in 2021 and went on to win the Science Writers and Communicators of Canada Book Award. In addition, Krista has been the producer and host of multiple podcasts, including the award-winning Diabetes Canada podcast and How to Talk About Mental Health. In 2025, she received the King Charles III Coronation Medal from the Royal Canadian Institute for Science in recognition of her commitment to fostering science culture in Canada. So I'm going to turn this over to Krista, and she's going to introduce our speaker for today. Thank you.
Thank you. Thank you for the kind introduction. And first things first, I'm going to let everyone in our audience know that we have a special format for these events. We call it a vodcast or a video podcast. So there won't be any PowerPoint presentations. So you're welcome to watch or listen or both to the conversation. We also highly encourage people to ask questions in the chat box during our interview, as we'll have a discussion afterward with our guest. And we want this to be an interactive and helpful session. We know that many people watch these later on. And so if you have a question, someone who's watching it later may also have that. So please do drop it into the chat. And now I am thrilled to introduce our guest today, Ian Patton, who is the Director of Advocacy and Public Engagement for Obesity Canada. For over 20 years, Obesity Canada has been at the forefront of advancing understanding, challenging stigma, and improving the lives of Canadians living with obesity. They believe that every person deserves respect, dignity, and access to compassionate, evidence-based care, regardless of their size. Ian not only helps to coordinate many of the organization's activities and events, but has shared his personal story with obesity as an advocate and inspiration for many. And I'm very excited for this conversation as it's a really personal connection to my own life. And I think this is such an important conversation for us to be having. So really excited, Ian, to welcome you to this recording. And first and foremost, I will let you introduce yourself and tell us a little bit about who you are and what you do.
Yeah, thanks for that introduction and thanks for having me and appreciate everyone joining us for this webinar, podcast, whatever it is. Um, yeah, so I mean, you did a good job introducing me there. I guess a little bit more about me and my background. I started in this space as a student doing my PhD and graduate work in kinesiology, and that's how I initially got interested in obesity and the work that I'm in now. But I'm also someone who lives with obesity and about 10 years ago underwent some treatment, and that kind of shifted my direction more towards the patient advocacy side of things and the work I do with Obesity Canada now. So yeah, I definitely can talk more about my own experience and the stuff that I've done with Obesity Canada, but appreciate being here.
Yeah, I think it's a really important conversation that we're going to have today because Obesity Canada has so many incredible resources for healthcare providers and for people living in bigger bodies. And I think that for many people, myself included, there has been so much learning to come from this organization and the work that you're doing. So I'm excited to discuss some of that. Many of the people who have heard me speak before know about my own issues. I don't even want to call it an issue, but my own circumstances around weight. I gained a lot of weight over the pandemic with a health issue. And it was one of the most interesting times because I had spent my career talking to people about how it's not your fault. It's something that, there are so many reasons this could happen to you. And then as I walked back into all of these spaces where I had been working for years in the diabetes research field in a much larger body, it was a very, very startling revelation for me that the way we talk about people in larger bodies and in bigger bodies, people who are living with obesity, is not always great. And until I was in that situation, I don't know that I had understood it as deeply. And so I was really interested in the work that Obesity Canada is doing. And I would love to ask you why it's so important that we have these discussions about how we talk about weight.
Yeah, I think, I mean, you pointed to something really important there about like how we treat and talk about larger bodies in different, in different environments, in the workspace and those sorts of things. It's something that was definitely personal to me as well. Like when I was doing my PhD, my graduate work, I was presenting myself as an expert in this field, as someone who is going to national and international conferences presenting on my obesity research, but my body told a very different story. And so it I was uncomfortable in those situations and in those spaces, and it wasn't always necessarily because of the people in those rooms and how they treated me. A lot of it had to do with my perceptions of how they were thinking about me, and I was kind of putting that on them. I know a lot of the people in those rooms were the informed people that were, not the ones that are contributing to that stigma as much. But we're so conditioned to experiencing that type of stigma and bias in those spaces that we can internalize it. So I definitely related to that, and I definitely had a struggle getting through that period of time and kind of questioning my own worth and value and whether I should be doing this work. But to the point, it's important that we talk about this, and the work that we've done with Obesity Canada, I think, is really important because the our understanding of obesity and weight and size and those sorts of things has changed pretty dramatically over the last several years, and I think changing the narrative and kind of combating some of that bias and stigma and changing how we speak about obesity and how we speak about bodies and those sorts of things. Um, can have a really big impact and a positive impact on people and their how they interact with the world, how they access and interact with healthcare and all of those things. It can make it easier just in the way that we talk about this type of stuff.
Yeah, and I think that you hit on so many things because I remember so deeply looking around at many of these conferences that I had been attending for years and realizing that I was suddenly the person in the largest body in the room. And yet we were talking about bodies that looked like mine without that sort of representation. So, how is Obesity Canada trying to change the representation of people in the room?
Yeah, that's another really good a good question. And Obesity Canada initially started as a research network. So it was about 20 years ago. We're actually celebrating our 20th anniversary this year. So about 20 years ago, Dr. Sharma started the Canadian Obesity Network at the time. And it was initially intended to be just that, a network of health professionals and clinicians and academics and people that were working in this space of obesity and trying to bring all these different areas and topics under one roof. And it was a great cause. It was good at the time, but we evolved over the years, and it was about 2015 when things started to shift and we started to see more. We made a concerted effort to do more inclusion of the lived experience. And so it started with just having workshops or people engaged in our conferences and having that representation there because it was important to ground the work that we were doing, the research that we were presenting at our conferences, and the change that we were trying to create. It was important to ground that in the lived experience and to have that representation there. And that just built and built and built to now it is central to pretty much everything that we do. And all of our all of our work that we do focuses on that lived experience that has people living with obesity kind of central and included in that work. And that representation definitely matters.
Yeah, absolutely. And another really important thing that Obesity Canada does is they have developed the clinical practice guidelines for treating obesity, which are absolutely extraordinarily. They're wonderful. I've talked to Dr. Sean Wharton, who was one of the leads on that, many times about just how important those are. And one of the reasons I think they're so important is because they actually looked at the structural inequities and things like racism and socioeconomic factors and all of these different things about how and why people may be living with obesity outside of the ones that are stereotypical. And why was that important to the organization?
Yeah, I think when it comes to the clinical practice guidelines, I think um, the central kind of basis to those points that you were making there is that there's the recognition that this goes way beyond simple uh, size, weight, and BMI. It goes beyond someone's behaviors around food and nutrition, which is historically where we kind of point to when we talk about obesity. And so we recognize that it is much bigger than that, and that there's a lot of other contributing factors. Now, I don't know whether we necessarily address some of those socioeconomic kind of pieces that contribute to it, or even, the components that go around with racism or bias and those sorts of things. But there's the acknowledgement that that contributes to this for some people and that it is a complex issue. And I think that's why our guidelines um, have kind of become that global gold standard. We have other countries that are now using the clinical practice guidelines or adapting them into their own regions. And that's a really big point of pride for us. And so they're also a piece of work that are constantly being updated, and they're kept as kind of a live document. So as new evidence becomes available, we can update those more rapidly than what we had done previously, where you do a guideline and then you leave it alone for 10 years and try and redo it 10 years down the road, which is a very big, long process. So the guidelines have definitely become kind of one of our main pillars and things that we lean on to direct a lot of the work that we do.
Excellent. I know that they also acknowledge and talk about something that the organization talks about quite a bit, which is weight bias in medicine. And for anyone, I think, at least from my conversations with many people, oftentimes the person that you feel the most shame and stigma from is your healthcare provider. And that's often a really unfortunate thing because our healthcare providers, we go to them for support, and often if you feel stigmatized, you're less likely to get the help you need, and so many other things. So, why was it important to the organization to acknowledge this and to create resources to help healthcare providers to overcome perhaps some of the stigmas that they might have?
Yeah, the bias piece I think was the one of the main bridges between the people with lived experience, our community members that have lived experience, and the kind of academic health professional side. Um, because you have the science and the information telling you that there's these things that should be happening, or this is how it should be. And if you're a clinician, sometimes they can be very matter of fact and kind of think in those those terms. The evidence says this, we need to do this, and that's that. Um, but the experiences of the people living with obesity and how they've historically been treated hasn't been super kind. And that leads to, as you mentioned, healthcare avoidance and kind of a breakdown of that patient-provider relationship. And I think in order for those clinical practice guidelines to have any meaning or to have any real impact, we needed to acknowledge that and recognize that that is a major barrier right now. We can have the greatest guidelines and evidence and science available, but um, if we're not, meeting people where they're at and identifying and dealing with some of those barriers that are there that go beyond some of those, the science and the recommendations that are in the guidelines, it's not going to have the impact that we want. So, addressing obesity and weight stigma is kind of the central piece to this whole puzzle because that's a real limiting factor for a lot of people. We've been conditioned to expect to be treated poorly in healthcare, especially. There's a lot of people who have a hard time, raising the issue and asking questions or talking to them because they've, had previous experiences or they have friends and family members who've had some pretty terrible experiences. So that is definitely one of the big pieces that we have to figure out. And I think about it as such a low-hanging fruit because it doesn't cost a whole lot of money. It doesn't cost, we're not talking about increasing access to expensive treatments and stuff like that in order to address that bias. It's such a simple thing, when we really get down to it to deal with, but it is a huge issue for our population, the people in our community.
And I know that for many people in healthcare, they want to do a better job with this. They really want to make a success of being more empathetic and making their patients feel seen and heard and understood. And so I know that Obesity Canada has some resources. And so I wanted to give you the opportunity to talk about some of the resources that you have available for healthcare providers.
Yeah, absolutely. Well, since the publication of the clinical practice guidelines, they're a pretty obvious first starting point for healthcare professionals, but we do have lots of medical education that is based off of the clinical practice guidelines. So, and there's different levels of it. There's introductory, kind of simple, learn at your own pace type education, and then we have more involved uh, and accredited education that can, be a little bit more, like I said, a little bit more involved, but can have a little bit more impact. And it covers all those different pieces and how to practically apply some of the clinical practice guidelines into your practice and those sorts of things. We have specific training on weight bias. So that's a useful tool not only for health professionals, but people that are working in the offices of health professionals or in hospitals or in those settings. Um, we have education that focuses on obesity in the workplace as well. So like we kind of cover a bunch of different areas that um, we can kind of educate and partner with people on those sorts of things. And the other piece to this puzzle is oftentimes when we talk about weight bias in healthcare, especially in the patient community, we tend to almost blame and shame the health professionals this and it's like the opposite of what we're trying to push back and make change for being shamed and blamed as patients, but we're doing that on the reverse side to the health professionals. So I think there's also the other piece to that is people living with obesity also have to recognize that the vast majority of health professionals, they get into this because they truly want to help people and they're not, treating people poorly intentionally. I have a hard time believing that a lot of these experiences are intentional efforts to, harm people and be mean. I think it's just a part of it has to do with we're asking a population of professionals to treat and manage something that they haven't been given the tools or resources to do historically. It's not something that is taught or included in their medical education to a great extent early on, like in med school or whatever their training is going to be. So you're asking them to help you with something or fix something that they weren't quite prepared to do, and that can be frustrating, I can imagine, for any professional. So those communication kind of lines can break down, and that can kind of lead to some of that perception of bias as well. So there's kind of two sides to it, and I think both the patients and the providers need to be open to repairing that relationship and kind of working towards that.
Yeah, it's a really important point that you're making, because I also feel like most of the time people want to just do the best that they can, and they may not even realize that that interaction is having the impact that it is. And I loved Obesity Canada worked with Diabetes Action Canada on these wonderful resources. Al Martin and Matt Larson were two of the members of the DAC Fellowship, who are, men living in larger bodies, and they created a comic book about interactions with healthcare providers that not only gave some suggestions, some very helpful suggestions about how to reframe those conversations. But I think it sort of shared the experience of men, which is often a voice that we don't hear in the conversation. And I thought was important too. And so I wanted to give you the opportunity to talk a little bit about working on that project with DAC, who are one of the Type 2 Diabetes Network's partners.
Yeah, that was a really interesting project, and I was really glad that we were asked to be a part of that. And obviously, Al was someone who was familiar to us, and I really enjoyed their approach of um, trying to raise awareness of those situations and creating a method, like having it done with these comic book strips was just a new way of kind of translating that knowledge and getting it across in a new and interesting way. So it allowed us to have a little bit of creativity with those storylines and how they were going to present them, but they were also in nice biteable sizes that were easy to share, and I think it got the message across. And again, to your point about that perspective of men living with obesity and diabetes as well. Um, it's something that is definitely missing from a lot of our communities and a lot of our spaces. So, I'm a patient advocate. I speak up, and I've been doing this for, several years now. But I can tell you, when I went through my treatment, so my bariatric program that I went into, there was, in the orientation, there must have been 80% females in that program. And every time I went to that program into the hospital and was going to my appointments, it was the same thing. There's a lot of females there, not a lot of men. I'm in a number of online peer support groups, and it's not men that are joining those peer support groups en masse. It is overwhelmingly females that are in those groups. And we know that the prevalence of obesity is not something that has that same discrepancy, right? We know that it affects both men and women relatively equally. So it's a little surprising that those voices aren't as prevalent. And so I think it's nice to have people like Al and projects like that that allow us to kind of get that perspective. And I think we need more of that. So it's definitely an important piece to the puzzle as well.
Yeah, and I will say, for anyone who is interested, you can find that resource, that comic strip, on Diabetes Action Canada's website. And I really hope that people will check it out, because I think Matt and Al did an incredible job of putting together their own experiences. And it is funny, because until I started talking to Matt and Al about it, I had never really thought about the fact that it is primarily women in many of these spaces, especially talking about weight. But it seems that it's a very important issue that we need to be looking at from, a much wider lens. So that also sort of brings me to my next question, which is around another topic that is very prevalent in the diabetes community right now, and especially in type 2 diabetes, which is remission. and the idea of diabetes remission, which is a wonderful thing. Like it's wonderful that we're having these conversations. But I know that for myself, one of the most I don't want to say traumatizing because I think that's too strong of a word, but most upsetting experiences for me was being in, an academic research discussion about remission and hearing some of the ideas about how, all I had to do was just give up solid food or, some very intensive ideas. And I walked away from that thinking, wow, if we're going to talk about remission, if we're going to talk about things that are very diet and lifestyle intensive, how do we do that in a way that isn't inadvertently shaming and blaming people or making them feel like they have to make um, really draconian, in some cases, decisions in order to, lose the weight and then therefore go into remission? And so I would love your thoughts on that if you have any.
Yeah, I definitely do. Maybe I can kind of approach it. I think there's definitely a lot of parallels between obesity and type 2 diabetes, and I don't have personal experience with type 2 diabetes, but I do think there is lots of crossover there. So from the obesity side of things, I think one of the biggest challenges when it comes to this piece is how tightly connected those behavioral things that you're talking about. So the changes to the diet and the extreme exercise and stuff that gets pushed onto us, like that narrative of eat less, move more. It's so simple. That has been one of the most harmful and hurtful things out there when it comes to the bias and stigma that we experience. And it's just how we're framing it and how we're speaking about it. So you're kind of you're essentially saying that those things, eating less and moving more, diet and exercise, are the solution to this problem. And it is a very complex problem. And we already mentioned that there's a whole lot of other contributing factors. And so you can't solve complex issues with super simplistic solutions. Um, And so having such a simple equation just it doesn't work. It hasn't worked and it's not going to work. So we need to do something a little bit different. We need to think about it a little bit differently. And I want to be very clear. I'm a kinesiologist by training. I was at one point a registered kinesiologist and an exercise physiologist. I've taught nutrition at college. Like I get it. I fully embrace and believe that, being physically active is probably the single most important thing you can do for your health and well-being. So I definitely don't want to get to like a message of I'm saying that there's no part of that equation should be in there. It's definitely an important part for everyone's health and well-being. What we need to do is we need to decouple that from size and weight and from treatment for any disease, whether it's type 2 diabetes or obesity. Those things are they're important. They should be encouraged. We should be working on them. Everyone on the planet should eat healthy and move their body more than they have previously. Those things are fantastic and great, and they should be encouraged. But when we're saying that eating less and moving more is the treatment and the solution to obesity, for example, you're going to have those, you're going to have those ups and downs, those kind of ebbs and flows. It's not a linear relationship between those things and someone's weight status. And so there's going to be a point in time where there might be a little bit of weight gain or something, or where your effort in the exercise doesn't translate to what's on the scale. And that can create more problems than good. And so we need to decouple that and start talking about those behavioral things more as an outcome of effective treatment when we're talking about obesity. So in Obesity Canada's guidelines, we have three pillars of obesity treatment. And so that's the psychological intervention, the bariatric surgery, and pharmacotherapy. Those are the evidence-based pillars to obesity treatment. And on that image, you have the physical activity and nutrition kind of on top of the pillars. And it's kind of depicting that those treatments support or allow someone to be more successful in those behavioral things. And so just changing how we speak about those things can have a really profound impact on that bias and stigma. And I think it would be something very similar in the diabetes side of things as well.
Yeah, and I think you sort of hit the nail on the head in terms of what I was experiencing, because for all of us who have had that experience of gaining weight and doing all of the things that you thought were the right things, but they don't work. Like I was a runner for years and I was very healthy and eating all of the things I was supposed to. And suddenly that didn't work. And it was that moment where you sort of realize, oh, this thing that we've kind of had ingrained in us, like eat, move more, eat less, that's all you have to do. It's not always effective. And it started to really play into the mental health side, which I think a lot of people also feel, because it starts to be like, oh, well, I obviously like feel like I don't have enough willpower. I'm not doing enough, or I'm failing. And I don't think that messaging is helpful. So how can we help people who are perhaps experiencing those feelings feel a little less upset by this narrative?
Yeah, I think over the last couple of years, and I think, I mean, I come from this is almost like I'm definitely from a position of privilege with the people that I get to work with and the minds that I get to pick when I'm on different Zoom calls and at different conferences. But I think what has helped me is recognizing that, what I'm dealing with is uh, and some of the challenges I've had with my with obesity has been number one, not unique. It's something that a lot of people experience, and it's, a familiar experience for a lot of people. But the other part is that it is not just something that can be controlled via willpower. I have a lot of willpower. You know, done, I've done some pretty incredible things when it comes to, those behavior things. When it comes to exercise and nutrition and those sorts of things. And it still didn't work. Though, I've lost the weight, but it comes back. And I think for me, what really helped was recognizing that there are biological, physiological, and there's reasons why our bodies actually resist weight loss. So when I've lost, 50 pounds or more, going to the gym and exercising like crazy, that's not something that my body recognized as a super positive thing. Flags went off going, oh my God, he's dying. And there's, actual things going on inside my body that my willpower cannot control, that come into play there. And so just recognizing that there's certain things that I have control over, and then there's parts of this equation that I don't have complete control over, was one of the major kind of tipping points for me. And, when we talk about having those ups and downs, um, for me, going through obesity treatment hasn't meant that I've got this straight line of like losing weight. I still have those ups and downs, but I find the peaks and valleys are much smaller and shorter. There's not so much variation. I'm not falling off the wagon for extended periods of time. I'm able to kind of correct myself and bring things back quicker. So there's a couple different pieces to that.
Yeah, and you bring up something that I think is really important, and something that I feel that you have been an inspiration to me in, and that's you've been very open about the treatment that you received for your obesity. And for a lot of people, discussing the idea that you're going to have a therapeutic or a medical intervention can be very fraught. And I have, because of in many ways of your influence, done the same thing with my own journey, because anyone watching this video is going to say, like, what are you talking about? You don't look like someone in a larger body. Because I also have a lot of privilege and work with a lot of really wonderful people who helped me understand that maybe I needed an intervention, that maybe there was something more I needed. And so I've used the GLP-1 injectables in order to, manage and support my health. And why do you think that we need to be talking more about this? Because so many people are like, "Oh, you cheated!" Like, "Oh, you did it the easy way," as if somehow we're in a competition and our health is not the most important thing. So I would love your thoughts on that and why you chose to share your story, which, by the way, again, very inspiring.
Yeah, I appreciate that. I think okay, there's a couple things I would say here. The first thing, because it's just top of mind, is the piece about it cheating. Like I get that a lot. I've heard people say it. I've had people say it to me. You've had bariatric surgery or you're taking one of the medications that's cheating. We know it absolutely is not cheating. Going through and having bariatric surgery is a life-changing decision. It is a very, very big commitment, and there's nothing easy about it. Um, I'm managing a chronic disease, and I'm going to be doing that for the rest of my life. There's nothing easy about that. And it doesn't mean that I don't have to do those things that people think we have to do, the diet and exercise. I still have to put effort into those spaces. Um, my treatment just allows me to be more successful in those pieces. But when people get into that conversation about cheating, the other point I bring up is we're talking about your health and longevity. We're talking about me spending more time with my kids, being a productive, happy father, being able to live a longer life with the people I care about. And when it comes to that, if it was cheating, I would happily cheat every single day and twice on Sunday when it comes to my health. So it's a moot point either way. I think it doesn't hold a lot of water. So I kind of brush those ones off, uh, which isn't always easy to do, but I'm very confident in that approach. Um, and then I think why it's important to speak about this and why I started sharing and kind of being open about my experience is I was involved in this organization in this space as an academic, as someone who is researching, and I didn't talk about my weight very openly, even though it was very openly visible. Um, and when I started going through and realizing that I was quite ill and I needed to do something to uh, to live a healthy life and to be able to be the parent that I wanted to be and do the things that I wanted to do, I needed to do something significant. I needed to have an intervention. And so I had to go and ask for that help. And even though I had a PhD in this space, even though I know all the main doctors that are operating in this world in Canada, I still had to go and ask, and that was a very uncomfortable conversation to initially have with my doctor. And getting a referral wasn't the smoothest process. I had to push a little bit. I had to fight for what I knew I needed. And I thought about it and I was like, if I, as someone who works with this national organization, if someone who has a PhD in this and is friends and can speed dial some of the best doctors in Canada has an issue with this, what about the person who doesn't have those connections and doesn't have that training and isn't reading journal articles on this topic every day? Like what about those people? And so I've kind of had this, if not me, who else is going to do it? And so I started just being very open. And I think part of it was um, making sure, like I'm just always I've always been fairly open and honest about these types of things. And I think going through the treatment kind of gave me a little bit of a spark going, I can do something good here. I can make a difference and I can bridge these two worlds that I'm living in, that health professional academic side with the lived experience side. And so it worked out being a nice little niche for me, But I think one of the biggest things that I found has been very inspiring is hearing all the other people who do this. So whether it's here in Canada and the people that I work with that are also being open and willing to share and encouraging others to kind of change that narrative. And then the different people and groups that are globally that we're involved in that are doing the same thing. And I think it's really inspiring to see that we're kind of normalizing um, this discussion and changing it so people feel a little bit more empowered and more willing to share their experiences and recognize that they deserve better.
Yeah, I think that is so incredibly important and so needed. And so I do, as we're sort of getting to the end of our discussion, I will invite people if in the chat, if you have questions, please do ask them. We're happy to take those after we finish our conversation. But I wanted to talk a little bit about the resources. And one of the resources that, you just alluded to is, having people who are advocates. So if people are watching or listening to this and they are interested in advocacy, can they go to Obesity Canada to get involved? How would they do that?
Yeah, absolutely. If there's people that are, living with obesity, we have an online community, OC Connect. That's always a good place to start. They can always reach out to us, and we definitely have resources and information. We do a lot of public education. We have like webinars and conferences and stuff like that where you can learn about obesity, and you can kind of empower yourself so that you can ask the right questions when you go to the doctor. And those are types of things that we help people with pretty regularly. So yeah, there's definitely resources available for kind of everyone involved, the health professionals and the people that are working in the space, as well as the people with lived experience who are looking for support.
Yeah, and you also just released the guidelines for children, treating children with obesity. So I wanted to, one, give you the chance to promote those to anyone who is listening, who is a healthcare provider, because I thought they were really wonderful, and just to talk a little bit about why that was something that the organization has released.
Yeah, the pediatric guidelines were just like the adult guidelines, a long work in progress. So this was a couple years in the making, but there's definitely a need to have those guidelines that align with what the current state of the evidence is. And so with these guidelines, we have kind of a good starting point. I think when it comes to the pediatric guidelines, there's definitely going to be a lot of change. We're going to get a lot more evidence. And I think that was one of the things the guidelines pointed out was that there's still a lack of evidence in the pediatric population for a lot of these things. So there is some evidence that for some of these treatments and things like that, but there's gaps when we compare it to the adult population. So we do definitely need to kind of shine a light on that and kind of fill some of those gaps moving forward. But it's good to have, obesity across the lifespan kind of covered between those two guidelines, which is something we're very proud about.
Excellent. And this has been such a lovely conversation for me, and I have found it so wonderfully powerful. I hope that everyone who listens to this will find it also equally helpful. And before we end the portion where we're discussing, I wanted to make sure there wasn't anything I had missed that you really wanted to make sure that we shared with the audience.
I think just looking at my notes too, I think we covered all the main points. So if there's any questions, I'm happy to answer some of those things. I think, although the one note that I had here is the point about how friends and family can be helpful in the conversation and be allies there. And I think I mentioned this in a different context. It wasn't necessarily around friends and families, but it was a couple weeks ago when I was doing a presentation for workplaces. And someone had asked a similar question, like, how can we be allies? How can we support people living with obesity in our workplace? So in the same vein, if we're talking about it in the home or people that we care about, And the one point I wanted to bring up was, there's one thing to be supportive and helpful, and to be a good friend or a good family member. The one thing we should all really stop doing is commenting on each other's bodies. And whether we're talking about that in a positive light or a negative light, it doesn't matter. We shouldn't be talking about each other's bodies. And the example I gave was, um, all the well-meaning people who, wanted to compliment me and wanted to say nice things about me when I changed drastically. So like when I had my bariatric surgery and I showed up to a conference and I was very, very different than what I was previously. And I had everyone coming to me and telling me how fantastic I looked and how great I was and all this other stuff. And I had all this attention and it was really, really uncomfortable for me. Even though it was a positive thing, it was really, really uncomfortable because I was the same guy, right? I hadn't changed. I was just as smart and, you know, productive and valuable and, funny. I had all the same qualities, but my body had changed. And I really struggled with that experience of like all that positive attention that I got when my body changed. And I think it had to do with, knowing that, my struggle with obesity and the stuff that I went through my treatment wasn't necessarily about weight loss. Weight loss was a product of a lot of those, like of that treatment, but it wasn't the purpose for it. The purpose for that was for me to gain my health back and to be able to be functional and to move and to be able to be the father I wanted to be. And none of that was captured by the way that my body looked. So I really struggled with that. And so I really think we need to, part of, this dealing with weight bias and stigma and stuff is not only changing the narrative and how we're talking about weight and bodies and those sorts of things, but knowing when it's appropriate and when it's not. And I think there's a lot of spaces where we just shouldn't be talking about each other's bodies because it's not relevant.
Yeah, I can relate and appreciate that so much. So I think I'm really glad that you got that point in. And I wanted to share a question from the audience, which is, as a healthcare professional, you're often taught to really focus on lifestyle and to really push those sorts of things. Is there a way, or do you have advice on how to do that with still keeping in mind how a person feels?
Yeah, I mean, like I mentioned, we absolutely should be encouraging healthy lifestyles and we should be, supporting people and helping people to adopt the healthiest lifestyle that they happily can do. So I'm not saying we shouldn't be doing those things. We should be framing them in a way that we are not framing them as a treatment to a chronic disease. It should not be tied to weight loss as a specific goal. We should be, connecting it to the other outcomes, the quality of life, the function, those sorts of things, that are more important and probably a better indicator of someone's success in those things. So just really focusing on how we frame and talk about those lifestyle interventions. The other thing that I find or that I hear a lot about is, if it's a health professional like a doctor or someone who wants to get that message across, sometimes it can be very difficult in such a short period of time that you have with the patient. And so then it gets just kind of thrown out there and it ends up what the patient comes away with a lot of times is I was just told to go eat a salad and walk more. And that's not useful takeaway information. It's not actionable. So if we are going to talk about lifestyle and stuff like that, let's, give some support or resources that are going to allow people um, to do those a little bit more effectively. Give them something that's actionable, um, or send them to someone, refer them to someone who can support them in those things. It might take a little bit more time. Things like motivational interviewing and the psychological side of the pillars that we were talking about for the treatment of obesity, those things can be very helpful, but we have to know when it maybe falls a little bit outside of our scope and when we could use some support.
Yeah, it's really interesting. You touched on this a little bit earlier as well, this idea that when we go into the doctor's office, sometimes we are like gearing up for that conversation, like, oh, you have to lose weight. And even if we go in with a broken arm, we feel like the first thing that they're going to say to us is, you should, lose a little weight. And so I think that when you mentioned earlier about how the patient also has to, reframe the conversation, we both have to be in that same headspace to have those difficult and interesting interactions and maybe focus on things that aren't the weight, if that is not the thing that the person is there to see you about also.
Yeah, absolutely.
And I think those are all of our questions today. Unless anyone else wants to sneak in and say something, feel free to do so. But I am happy to give everybody a little bit of time back. And I want to very much thank Ian. And I know that we have put quite a few of the resources mentioned. Thank you to Talia for putting those in for us as well, so that you can find the Obesity Canada information. It is a wonderful, wonderful organization. And I will let you know also about the Type 2 Diabetes Network, and that there is no cost to become a member of the Type 2 Diabetes Network. And it is a wonderful organization where you have access not only to these types of resources, but many others. And so I'll thank all of you who joined us today. And we hope that you'll join us for our next session. And that we'll be joined by Dr. David Campbell to discuss diabetes and the social determinants of health, including for those experiencing homelessness. And we'll be sending out information about that soon. And again, if you're not already a member, please consider joining. Rana has put the URL for how you can join in the chat. So thank you so much, everyone. It was lovely to see you all.